Hey y'all, I'm Kara, founder of Bravely Go, and today's video is brought to you by our Patreon. That's right, we have a lovely community full of glorious patrons who help me create content just like this video. Patrons also get a lot of fun perks like event discounts, exclusive video content, and quarterly AMAs with me. So if you dig what we're doing here on YouTube or elsewhere on the internet and you want to be a part of it, check out the link in our description. I recently got a $3,550 ambulance bill. Honestly, it feels like a rite of passage as an American, which is, getting totally f***ed by the healthcare system. For those of you who do not follow us on Instagram, and you totally should find us at We Bravely Go, you may not know that I was hospitalized in early August of 2022 and subsequently had to spend 3 days in the hospital. Since then, I have had several major medical procedures in pursuit of a diagnosis. Now, I'm not going to share all of my medical details on the channel because privacy is important, but I do think this topic of healthcare in the United States and how to afford healthcare in the United States is really important, especially if you are a younger person. I'm 34 years old and I am now dealing with this pile of medical bills and also this pile of medical, frankly, overwhelm when it comes to getting the care that I need. And I just want to apologize up front because as we go through this video, I am going to repeatedly lose my mind at the absolute cluster F that is the American healthcare system. So go ahead and give this video a like to help me retain my sanity. How the United States healthcare system got so messed up is a complex issue, so I'm just going to come at this from a high level, kind of top-down view. Some of our major problems are fee-per-service charging structure, doctors needing high insurance coverage since we are an extremely litigious country, unregulated prescription drug costs, a for-profit mindset throughout the healthcare industry, more testing for more diagnoses, an employer-based healthcare system, tying healthcare to a full-time job. This leaves part-time workers and unemployed people without healthcare coverage. And finally, different health insurers charging different prices for the same care, creating higher admin costs. Long story short, we charge way more money than any of our peer countries for way worse care. We look at healthcare as a business, and everyone from health insurance providers to doctors to drug manufacturers are out to try and make as much money as possible. This is a bad system. It's a heartless system, it's an ineffective system, and it's an expensive system, not just for us as individuals, but also for the United States government. Nothing about what we're doing here makes sense or works well. Collectively, medical debt in the United States stood at $195 billion or more in 2019, according to Kaiser Research. Medical debt particularly impacts the Black and Hispanic communities, young adults as well as older adults, low-income individuals of all races and ethnicities, and veterans. Additionally, medical debt is more prevalent in both the Southeast and the Southwestern United States. Hello from your fave 34-year-old Latina living in Texas. Checking off boxes right and left. A 2022 report from Kaiser Family Foundation estimated that 41% of people, or about 100 million adults, currently face medical debt, ranging from under $500 to $10,000 or more dollars. Using $2,500 as a base level, 56% of people who carry medical debt and or dental debt owe below that amount, and 44% owe that much or more. So basically, throw a rock and you're gonna hit someone in the United States who has medical debt. And honestly, the American healthcare system can be better categorized as the American debt system. Healthcare here is wildly expensive for us as individuals, despite the fact that the US government spends a lot of money on healthcare for us. The US government spent $12,914 per person on healthcare in 2021. That's a growth of 2.7%, with government spending reaching $4.3 trillion. As a share of the nation's gross domestic product, healthcare spending accounted for 18.3%. For anyone who's against universal healthcare means currently, as in right this very second, we are actually paying more for a non-universal healthcare system than we would if we had a universal healthcare system. What I'm saying is universal healthcare would be cheaper than what we've currently got. On a per capita basis, we spend nearly triple the average of other developed countries. Ugh, y'all, it doesn't have to be this way. Getting sick in the US probably will bankrupt you, but it probably won't cure you. A 2019 study from the American Public Journal of Health cited court records of bankruptcy filers between 2013 and 2016, with the end result showing that 66.5% of cases were tied to medical debt. Going to the doctor, being hospitalized, hell, even taking an ambulance. It's basically a one-way ticket to debt in the United States. And it's absolutely no guarantee of getting the proper healthcare or the proper diagnosis that you actually need. Because remember, this is the same country where 56% of people cannot cover a $1,000 emergency in cash. There's no mandatory paid sick leave. There's no federally subsidized paid maternity leave. And there's no federally subsidized childcare. I mean, we create healthcare problems in the United States, and then we overcharge people who are trying to fix them. And what really kills me is we still have people who are like, there's no other way, this is the only way we can do it, when literally the majority of other countries on this planet have figured it out just fine. Right now, as I'm filming this, I'm about $7,800 in medical debt, and I'm still waiting on 2 bills that should push me firmly into the $13,000 range. I've gotten a $3,550 ambulance bill, a $2,168.86 bill for 1 day in the hospital. I had to pay $1,400 out of pocket, so it was not covered by insurance, for a colonoscopy and an endoscopy, and I haven't even gotten the bill for my other 2 days in the hospital, so I'm not even sure how much that's going to cost me. Plus, I still have several procedures that are still on the calendar that I'm going to have to figure out a way to pay for. Do I have a diagnosis? No. Do I have a treatment plan? No. Have I been prescribed any medicine? No. So if I can get diagnosed by March 2023, I will probably have ended up paying $20,000 out of pocket just for a diagnosis that took me 8 months to get. I mean, does this look like success to anyone else? Because from my perspective, it doesn't. It really doesn't. All right, y'all, sound off in the comments. What has your experience been like in the US healthcare system? Do you currently have medical debt? Let me know. And also let me know if you're interested in a video about how I am negotiating my healthcare costs, because I'll tell you right here, right now, ain't no way I'm paying $20,000 out of pocket for this nonsense. Oh, and make sure to like and subscribe. Bye.